The LGBTQ community faced many challenges during the pandemic, from health care access to housing discrimination.
And as the community celebrates Pride Month, 10 on Your Side's Jon Dowding took a deeper look at how people came together during a time of need. John?
Well, Tom, Anita, mental health, access to health care, housing, food insecurity, and isolation. Everyone has struggled with some of these issues during the pandemic, but for one group of people already marginalized because of their gender identity and sexuality, the pandemic brought extra layers of complications to their lives.
There's things about being LGBT that are already very challenging, and that contribute to mental health and medical disparities. And when you add the pandemic into that, it's multiplied. It's even worse.
For a social community that relies on each other for support, finding someone who understands your struggles, like coming out or transitioning, is important, especially during a global shutdown. LGBT providers understand those struggles and don't force a patient to hide who they are.
And sometimes when you go into a non-specific LGBT provider, they have all that other stuff that just sits between them and the provider. And so here, that doesn't sit there.
The LGBT Life Center says the pandemic presented challenges not only about how to continue providing care through their medical clinic with Can Community Health, but also how to address new needs that surfaced because of isolation.
The uniqueness of maybe not being out, but being in your home and not having any kind of outlet, we felt like that was a priority population to serve.
Throughout the pandemic, the center saw an almost 150% increase in mental health appointments. In order to meet the need, they utilized telehealth appointments for the first time, which they say was popular for many patients.
Not all spaces are safe, unfortunately, even counseling spaces. So I think there's something meaningful about going in to the LGBT Life Center and knowing that you're going to be accepted.
The food pantry doubled the amount of food they gave, and a more structured senior services program developed as well during the pandemic. But the housing program grew the most as millions of Americans faced job and housing insecurity. Beth Brooker, who runs the center's housing program, says the AIDS epidemic served as a blueprint during COVID-19, as housing discrimination continues for many in the community.
And we have higher rates of poverty, higher rates of homelessness, and higher rates of discrimination in housing. So this program is very important to helping our community just be better.
For James Jorgensen, he needed help filling out housing applications. He wants to help as many people as he can, but needed help himself as he suffers from hand tremors.
And that means a lot. It's basically somebody's got your back. Even though they've got their own duties and responsibilities and criteria to follow.
Through the center, he gets help with housing and medical treatment. He says his appreciation for all the help he's received goes beyond words.
No matter what your gender, race, nationality, sexuality, there's somebody here for you.
Somebody's got your back. Whether it's housing assistance or mental health counseling, staff say it's important to have people who belong in the community and understand the trauma of those they're looking to help. Jon Dowding, 10 on Your Side.